The Stroke Health and Wellbeing Service came about in response to NHS England's Squire programme, so that's the Stroke Quality Improvement and Rehabilitation programme. What we set out to do was to create a service that was truly personalised and integrated, that put what matters to you really front and centre in a person's care, that it would be available 7 days a week, that it would be sustainable and replicable, that we would be able to lift it and shift it into other places, and that it would proactively address health inequalities. Here exists to tackle the really big challenges in healthcare today, and when we talked to our stroke survivors and people in communities, we heard that sadly there is often people have quite a poor experience of care and support once they've had a stroke. There's a sense of fragmentation of there's lots of resources, there's lots available, but how does someone find the support that they really need? There's also a sense amongst care workers that they're working as hard as they possibly can, but there just aren't enough of them to meet the demand for high quality services that they really want to provide. And of course we know about health inequalities and how often the people who most need care don't get the quality or the care that they really need. At Here, our work is tackling these kind of challenges and creating outstanding personalised care for our whole communities. And that's what we did with this project. What this looks like in practice is that we're bringing together different kinds of expertise to support someone's needs. So their medical needs, of course, but also their social needs, their psychological needs, their personal needs. So imagine a triangle, and in the centre of the triangle is the person, but not just that person, also their loved ones, the people close to them who will be doing that day-to-day care and support. And then the 3 points of that triangle are lived experience leadership, so the people who have lived what they're going through, who have walked the road themselves and are now wanting to support others. We have our non-clinical expertise, so those people who are really expert in what community services are available, how to get the support that you need, and also have some coaching expertise as well. And then we have life-changing, life-saving and highly skilled clinical support. So together, those three work in partnership to create a supported recovery journey that's unique to that person. So our experience at Here is that when we have these three different types of expertise all working together, we can have really extraordinary results in terms of efficiency and in terms of effectiveness, but more than that in terms of experience. And with our project, we really saw how incredibly impactful it can be to have that triangle of support around the whole person. We saw some really outstanding and incredible results from this programme. So 92% of people who experienced the service said that they felt supported to get back to their hobbies and interests, the things that really mattered to them. So that's speaking to how this kind of support can enable people to navigate the system and to get what they really need to rebuild their lives. We heard from our clinical colleagues that having the stroke support workers and the health builders there meant that they were able to focus their time on the things that only they could do. We were told by the people who experienced the service that every single one of them, 100% of them, felt that they had been treated with compassion, care and dignity and respect in the service. So that's 100% of people reporting a good experience. Our health equality data, so where we layer experience and outcome and access on top of census population, told us that people were able to achieve their goals, be activated, be motivated, do the things that they wanted to do, get what they needed from the service, no matter where they lived. This has been one of those really rare learning opportunities where the benefits have been exponential. Having this opportunity to have space for innovation has created some really extraordinary results, but also some deeply meaningful personal experiences on all sides. What we've seen is that being part of this project has been immensely rewarding and life-changing, not just for those receiving the service, but for everyone who's been involved in it. So our lived experience leaders, our health builders, for them to have the opportunity to get back to work and to be supporting others has been truly transformative. For our non-clinical colleagues, it's been so deeply rewarding to support people to achieve their goals, and for the clinicians too. They've said, we have this wonderful space, our new building, so let's use it well. If you'd like to learn more about what we did and how we did it, you can see the stories from the people in their own voices or get in touch.